The province of Quebec has a new plan to tackle the COVID-19 pandemic, and that is a tax on the unvaccinated. So before I get to my thoughts on this, some details here from iPolitics. Only 10% of Quebecers aren't vaccinated against COVID-19, but they make up half the hospital beds being used by COVID patients, Premier François Legault repeated on Tuesday. Quote, "I know you are fed up," Legault said, addressing the 90% of Quebecers who've had at least one vaccine dose. As a question of fairness, his government therefore intends to make the unvaccinated pay at least $100 into Quebec's public pharmacare plan on top of their annual contribution at tax time. Health Minister Christian Dubé said about 2,500 people are now in Quebec hospitals, either because of COVID or because after being admitted for some other reason, they tested positive for the virus. If that level is maintained, hospitals in the province will need an extra 1,000 health workers and nursing homes will need 1,500 extra staff, Dubé said. So first, it's worth pointing out here just how the unvaccinated are clearly disproportionately ending up in the hospital. So over half the hospital beds are being used by COVID patients are unvaccinated, even though 90% of the province is vaccinated. But this isn't as clear as you may think it is. I'm going to ask you to, as good as it may feel, resist the urge to want to punish the unvaccinated as I explain the potential downsides to this. So first from CTV News, Vardit Revitsky, a professor of bioethics at the University of Montreal, told CTV News Channel on Wednesday that her main concern is that the tax will not increase pressure on the unvaccinated to get the jab, but will further certain inequities created by the COVID-19 pandemic. Quote, "From an ethical perspective, we're trying to select public health interventions that are the most equitable and just possible. This does not respect this principle," Revitsky said. Quote, "I think it would be more equitable to increase the pressure to vaccine passports than to target, again, individuals' pockets, when $100, $500 may mean almost nothing for some families and may be an incredible burden for other families," she said. So I echo these thoughts. It's not yet clear how this will be implemented if it is a flat fee and not a tax based on your wealth. If it's a flat fee, then you are disproportionately impacting lower income families for absolutely no reason. Once again, punishing those at the bottom of society. So I'm completely against that. If it's a tax based on your wealth, I have less of an issue with that, but it still doesn't get to the heart of what the real problem is, and that is the lack of public response and public support during this pandemic. Why isn't every person being sent an N95 mask? That should have been done at the beginning of this pandemic for everyone, not just in Quebec, not just Canada, across the world. That should have been the first initiative. Mass produce N95s and ensure everybody has access to one. But instead, in Quebec's case, look what they did. They were trying to sell 1 million N95 masks in their possession. This was a story from just yesterday until it was caught and this was taken down. Why weren't these being distributed among the population in Quebec? Isn't that a better way to cut down on the spread of COVID-19? I mean, you have the rare lawmaker here like Bernie Sanders in the US now trying to introduce legislation to send everyone an N95 in America. This should be done across the world. Another issue, transportation to and from these vaccine clinics. A lot of people don't have access to a car, live in rural areas. It's tougher for them to, leave work, get to a vaccine clinic. I'm sure at this point it's probably a tiny percentage of that 10% in Quebec, but it's still probably some people who cannot get the vaccine just due to convenience. So why not pay and offer transportation to anyone who is unvaccinated to get the vaccine? On top of that, paid personal leave days. Some people are facing or can't leave work or then have side effects from the vaccine. Everybody should be given paid personal days to get a vaccine and recover from the vaccine. Also, when it comes to our pandemic response in general across the globe, it's largely been dictated by massive corporations. So using Ontario as one example here, several of Doug Ford's key pandemic decisions were swayed by business interests. Star analysis suggests provincial lobbyist registry shows intensive business lobbying coincided with crucial decisions to let construction continue, allow more people on film sets, and permit big box stores to fully open, often against the advice of health professionals. So in Ontario, stores like Walmart were allowed to stay open, while small business had to close. How does that make any sense? But again, it's because our response to this pandemic has largely been dictated by massive corporations, and not just in terms of the public response, but also in terms of how the media has been covering it. So I interviewed Walker Bregman and Alex Koch on their report here, how the Koch network hijacked the war on COVID. As Omicron surges, a shadowy institute filled with fringe doctors appears to be part of big business's 2-year strategy to legitimize attacks on pandemic interventions. So if you want more on this, I'll link to this interview above and below the video, as well as this article here. But essentially, since the beginning of the pandemic, you've had big business interests manufacture misinformation around the pandemic response, around being anti-lockdown, anti-mask, anti-everything that would help us get rid of this pandemic, because it has served their business interests. So when we're talking about the unvaccinated, those that have been taken in by this cult, it's important to understand who's behind that. You can't simply blame the individual and their failings for falling into that trap. You have to look at the well-funded network that is behind the cult that they have now fallen into. So, look, I have to even personally resist the urge to want to punish the unvaccinated, because, yeah, they are the ones filling up the hospital beds. It is a massive burden on the healthcare system. But by simply blaming the individuals, we are missing the real issue at hand here, and that is the underlying problems when it comes to our lack of response, when it comes to a corporate-backed response, a corporate-influenced response to this pandemic, and when it comes to how they've been taken in by a well-funded cult. So, it's important to understand that getting out of this is not going to be easy, but when it comes to the unvaccinated, we have to have a more empathetic approach into understanding why they have fallen into what they have fallen into, and be understanding when it comes to giving them the support that they need to make the decision, hopefully at some point, to get the vaccine.